Dr. Neeraj. Welcoming our Honorable Vice Chancellor, ma'am. A very good morning to one and all. It is with immense pride and deep gratitude I welcome you all to the momentous occasion where we gather to celebrate the power of research and innovation. Distinguished dignitaries on the dais, our esteemed chief guest, Professor Sudeep Gupta, Director, Tata Memorial Center and Professor of Medical Oncology, Mumbai, Honorable Vice Chancellor, Ma'am, King George's Medical University, Professor Sonia Nityanand, Revered Deans, Dr. Amita Jain, Dr. Hardeep Mehrotra, Heads, faculty members of various departments, esteemed guests, brilliant scholars and researchers. A heartfelt welcome to Research Showcase 2024. Research Showcase today celebrates the commitment, resilience and innovative spirit of our academic community. At King George's Medical University, the pursuit of research excellence is a proud and a defining tradition. This event underscores the transformative advancements that shape the future of medical science. It also highlights our institution's growing influence on the global stage of discovery and innovation. So to commence today's proceedings, we begin with a heartfelt floral welcome for our distinguished guests. So let us all join in a warm round of applause as these tokens of respect are presented to our esteemed dignitaries. First and foremost, I request Honorable Vice Chancellor to please welcome Professor Sudeep Gupta, sir, our chief guest, for gracing us with his esteemed presence. Now requesting Dr. Hardeep sir to welcome our Honorable Vice Chancellor, Professor Sonia Nityanand ma'am, whose leadership continues to inspire and guide us. Welcoming Dean of Academics, Dr. Amita Jain, for her pivotal role in shaping the academic ethos of our institution. Finally, also welcoming Professor Hardeep Singh Malhotra, Dean Research and Development, King George's Medical University. Thank you. Additionally, we welcome many luminaries and accomplished individuals in the august gathering today. So welcoming Dr. Arun Chaturvedi, sir. Cordial welcome to Abbas Ali Mehndi, sir, Vice Chancellor, Era University. Dr. Vineet. Dr. Rashmi, we extend our greetings to you, ma'am. Dr. Kuril, sir. Thank you, everyone. We also express our gratitude to the members of the Research Committee and the members of the Ethical Committee. Thank you, everyone. Let us now embark on a meaningful tradition that signifies the illumination of minds and awakening of wisdom, the ceremonial lighting of the lamp that not only honors our pursuit of knowledge, but also sets a luminous path for the success of this event. I kindly invite our dignitaries to step forward to perform the lamp lighting ceremony, accompanied by melodious rendition of Saraswati Vandana.
शुभं करोति कल्याणम् आरोग्यं धनसम्पदा शत्रुबुद्धिविनाशाय
This act, steeped in symbolism, reminds us of the guiding light of education and innovation that brings us together today.
कानी कुंडलमोतीहार दिव्याला पाहून नमस्कार तिळाचे तेल कापसाची वात दिवा तेवे देवा पाशी उजेड पडे विष्णू पाशी माझा नमस्कार सर्व देव देवतां पाशी ये ग लक्ष्मी बैस ग बाजे माझं घर तुला साजे घरातली इडापिडा बाहेर जाऊ दे बाहेरची लक्ष्मी घरात येऊ दे घरच्या सर्वांना उदंड आयुष्य सुख समाधान शांती लाभू दे.
Welcoming our Pro Vice Chancellor Abhijit Kaur ma'am. Thank you ma'am for your presence, for joining us. Requesting Dr. Sujit, Vice Dean, Ethics Committee, to please welcome ma'am. Also welcoming Professor R.K. Garg sir and Dr. R.K. Dikshit sir. Thank you one and all. Honorable Vice Chancellor Sonia Nityanand ma'am, whose leadership has been a source of motivation and pride for all of us, and whose vision has truly redefined the way we approach education and research. Under her dynamic leadership, our institution has flourished, setting new benchmarks in academic and research excellence. It is with great honor that I now invite our esteemed Vice Chancellor, Professor Sonia Nityanand, to please deliver the welcome address.
Thank you. Professor Sudeep Gupta, who's going to deliver the Research Showcase Day oration today. Professor Amita Jain, Professor Abhijit Kaur, Professor Hardeep, all the distinguished faculty members in the audience, Professor Mehndi Hassan, who's come from Era Medical College, and all participants, all awardees, a very warm welcome to the Research Showcase today, and a very warm welcome to our chief guest, Professor Sudeep Gupta, who is the director of the TMH Tata Memorial Hospital at Mumbai, and also a very eminent medical oncologist. It's, I think, the first medical oncologist who's become the director of TMH. So that's a history in TMH also. And we thought of him as the right person to encourage us into the field of research and innovation, because he himself has been an arduous researcher and participated in so many, more than 500, I think, clinical trials, and played a very important role in making and deciding treatments, especially related to breast cancer and gynecological cancers. As you people must have felt in the past 1 year, that research is a very important focus now for KGMU, and I have tried to give rupees 10 crores for research funding. And I want all of you to come forward and write intramural projects. This is especially for the young people who've joined. So there is actually no age bar for writing intramural projects. Anyone can write, because it's through intramural projects you will generate preliminary data and then get extramural projects. So one round of intramural projects has completed, and the second round will probably start in January. The call will be sent in January. So please apply, make projects, stand up and defend them. And if you do good work in your intramural projects, you obviously are ready then to convert it into an extramural project. I must thank Dr. Hardeep Malhotra. He's made the Institutional Ethics Committee completely digitalized. And because of which this year, the Institutional Ethics Committee has been able to review 930 projects. I think it must be the largest number of projects that any institution must be reviewing in their ethics committee. 930 projects. Overall, it's been a good year. There have been, I think Dr. Hardeep will give a more detailed report, but about 22 ongoing extramural projects with a funding, good amount of funding also. And again, I would say that if you people, if any faculty member wants to have a national, not only a national visibility, but an international visibility, it will be through your research publications. No matter how much of clinical work you do, but the visibility which comes at a global level is through your own research publications. And it's good to establish your niche areas of research. It could be one, it could be multiple, and then work consistently in these areas so that at the end of your professional career you can have some meaningful work coming out in that niche area. I would strongly encourage you to do that. I also would like to congratulate all people who have been acknowledged by Stanford and who have been listed in the top 2 scientists of the world. I think there are 11 faculty members who have been listed in the top 2 scientists of the Stanford University. I think most of you are sitting here. Some of you are sitting here. So many congratulations to you, and may you be the source of inspiration to the other faculty members of the university. And I can just tell you from my own experience that the love for research is something that you just stimulate yourself to imbibe, because it is unparalleled. The results which come out of research, the jubilant moments which come out of research are just unparalleled. When you discover something, or you understand something, or you make some treatment decisions which come out of your research work, that joy is really unparalleled. So I would really encourage you to delve into the realms, to the depth of research in any one or more niche areas that you develop in your subjects. I want to congratulate the entire research committee and the institutional members of the Institutional Ethics Committee who have worked very hard, and Dr. Hardeep Malhotra for giving his leadership, and because of which we have a very encouraging research showcase today. Thank you very much, and again a welcome to Professor Sudeep Gupta.
Thank you so much, ma'am. So time to focus on intramural projects, lay the foundation and move on to extramural projects. According to ma'am, perseverance and staying focused is the key to success. Thank you, ma'am, for laying the foundation for the remarkable event today. and your visionary approach continues to inspire and propel us to greater heights. I also want to extend my heartfelt welcome to Dean, Faculty of Dental Sciences, Ranjit Patil sir. Thank you, sir, for gracing the dais. Welcoming Dr. Suryakant sir. My greetings to Dr. Rajendra Nath sir. Last but not the least, welcoming Dr. Rishi Sethi sir. Thank you. Thank you all. So ladies and gentlemen, over the past year, we have witnessed remarkable progress in fostering interdisciplinary collaborations and investing in cutting-edge technologies. These milestones have not only shaped our achievements, but also paved the way for advancing research excellence at King George's Medical University. And to share the roadmap, allow me to invite Professor Hardeep Singh Malhotra, the Dean of Research and Development, to present the annual report and shed light on our future aspirations.
Thank you, Dr. Pragya. First of all, I welcome our chief guest, Professor Sudeep, and despite of his busy schedule and he has been having few health issues, we really admire his desire and efforts coming all over to Lucknow from Mumbai. He had to cancel few schedules and we are really grateful to him to be here. Our Honorable Vice Chancellor, Pro Vice Chancellor ma'am, Dean Academics, Amita ma'am, and Dean Dental, Professor Ranjit, all the dignitaries who are in the audience, students, and all the awardees. And I would be presenting the annual report. And starting the annual report, I'll give you a brief overview of how Research Showcase came into existence. So this is the 20th year of the Research Showcase. This is for those who might not be aware of how it came into existence. Our research cell was formed in 1979, and on the silver jubilee of the foundation of the research cell, Research Showcase was started, and this is the 20th year. So you can remember, so that was the centenary year when the showcase was started, and our foundation day, we celebrated our foundation day on Saturday, 120th foundation day. This is the 20th Research Showcase year. So this is held annually, and the aim is to promote research, promote best practices, appreciate research, and help in the capacity building. So initially, when it started with plenary lectures. We had several people from Colonel Velu Nair, from Dr. V.M. Katoch, Dr. APJ Abul Kalam, Dr. Shiv Kumar Sareen, Professor Dhavendra Kumar, Professor Hari Gautam, to name a few who had been taking the plenary lectures. Since 2021, this was transformed after the oration was constituted in the name of Professor Devendra Gupta oration. The first oration, the orator was Professor Balram Bhargav, the Director General ICMR. In 2022, we had Professor K. Srinath Reddy, former President, PHFI. In 2023, last year, we had Professor Anita Mahadevan, who's looking after the human brain tissue repository. So with this brief overview, I'll take you over to the ongoing research activities. So in the novel research programs that was started by the research cell, we had the RISE initiative, which is in the form of research initiatives to support excellence. That is the RISE program in October of 2023. This was directed towards the overall program execution, as well as the advanced modules in research, innovation and training that was under the acronym AMRIT. Under the RISE initiative, we have been taking the PhD Foundation course lecture series. So that is usually a combination of 12 to 20 lectures on an average. So we have been doing so. Continuing our last year's activity on basic statistics and advanced statistics, we organized a full day hands-on workshop on sample size determination. We know that in any project, defining the study and sample size determination is the Achilles heel, something which we all need to overcome before we are formulating the study. These are the glimpses of the workshops that were conducted. Our resource faculty has been Dr. Subhash Yadav, and part of these things, they were funded by the DHR. This was the sample size determination, a statistician's perspective workshop, and we had a very huge response. We also did a CME on guidelines on submission of the proposal for ethical clearance. Many a time, what happens is that the delay in ethical clearance is not because of the review, it is because that it has been submitted inappropriately, incompletely, because of which the proposals have to be returned to the PI. We did a webinar on how to write and publish an article. This was done by Professor Rainer Huhn, who is the editor-in-chief of the Global Psychiatry Archives, University of Bonn, Germany. Another workshop on the training of the Institutional Ethics Committee members was taken. This was a holistic training which covered the GCP, the CDSCO, that is the NDCT Act, as well as the regulatory part which is given by the ICMR. This was done on 23rd September 2024. So I'll shift gears to another collaborative activity in the form of the Cochrane India Network, and we have served with us, as we know that Tata Memorial Center is also a part of the 9 centers in India who are part of the Cochrane India Network. And when it started, it was like not a very major activity, but over a period of time, this has transformed into an evidence synthesis unit in this part of the world. So now Cochrane India Network has transitioned into an evidence synthesis unit. Under the banner of Cochrane protocol development workshops were conducted, and we had a huge representation from the workshop that we did in April. We had a representation from around 17 medical institutions across India, right from Uttar Pradesh, Uttarakhand, New Delhi, Punjab, West Bengal, Karnataka, Tamil Nadu and Puducherry. The November workshop was a massive workshop, and we have representation from All India Institute, major institutes of India, and more than 10 states per se in this workshop. Under the banner of DHR MRU, and I must tell you, those who might not have been there in the foundation day, our DHR MRU was adjudged as one of the 3 best MRUs in India, and it is currently the only MRU that is offering the functionality of 3D printing. So under the ambit of DHR, a couple of workshops were organized. One was on digital planning using the Materialized Mimics Innovation Suite, that is the MMIS, and the second one was done on the basic cell culture. A workshop under the same ambit and funding of DHR, a workshop on research methodology was also done, and this was a collaborative activity with the Center of Excellence KEM and with the research cell. We had 25 participants from different parts of the Uttar Pradesh. There is an initiative by ICMR, DHR, which is in the name of Saransh, that is Systematic Reviews and Networking Support in Health. And KGMC is a nodal center for this thing and has been given the responsibility of training the faculty members in the state of Uttar Pradesh and Uttarakhand. We had 42 participants from different medical institutions across Uttar Pradesh and Uttarakhand, including AIIMS, BHU, and AMU. So we are proud to state that for the workshop and training sessions, we have a very good team. We have our director of Cochrane, Dr. Balendra, who is here with us in the audience. And this is in order of the alphabetical order, not to say who's up and below. So we have a nice team, and beyond KGMC, we have also conducted workshops at AIMS Rishikesh, that was run on 26th October, and in AIMS Bhopal, that was a marathon workshop that lasted from 12th to 16th of November 2024, that was beyond the borders of KGMU. Amongst the other programs and initiatives, this has been conceptualized by the vision of our Honorable Vice Chancellor, that is the BRIGHT program, which stands for Building Research and Innovation in Global Health and Therapeutics program. It has two parts: to develop KGMC as a center of excellence for clinical trials and therapeutics. This in future may gel with the Government of Uttar Pradesh program, that is the Promote Pharma initiative. And the center one is for the Center of Artificial Intelligence. We have been collaborating with the University of Manitoba, Canada. The program that is already on the program on program science, that is a postdoctoral fellowship program, is already in force. And we have been having lecture series and case discussions with them on, as in they have a program which is usually occurring at approximately 6 weeks interval. Another initiative that I wish to highlight is the SIB Shine, that is School of International Biodesign, Synergizing Healthcare Innovation Entrepreneurship. We have the director with us, Dr. Professor Rishi Sethi with us. So this was a bio incubator initiative that was funded by DBT from 2021 to 2026. And the aim was to train 50 postgraduate fellows in the next 5 years in biomedical innovations. So we have had a second tranche of fellows which are there. And this is the batch second for the year 23 and 24. Amongst the ongoing research projects, we have seen some good jump from 271 ongoing projects. We now have 288 ongoing projects. Earlier, 40 departments were involved. Now 49 departments are involved. Of the whole, 213 are sponsored. So a large chunk that we have is a government-sponsored project. 15 are sponsored by the international agencies, and the rest by the industry are the industry-sponsored research projects. So this will give you a glimpse of the amount that is in crores that is being received by the different projects, and the breakup of how government agencies, international agencies, and drug or pharmaceutical companies are supporting the research. In terms of the intramural grants, there have been some very important changes, and as something that was alluded to by the Honorable Vice Chancellor, in the past 2022-23, a total amount that was dispersed was 34.41 lakhs, and this year more than 10 times, that is 3.8 crore grant is available for disbursement. We are in process of sending the grants for disbursement so that they can apply for the institutional ethics clearance so that the intramurals can be applied. The changes have been major. Earlier this was only for the young faculty members. Now faculty at all levels are eligible for the grant, be it additional professor or professor. So now it's not limited to the younger faculty, and the funding amount has been increased to 5 lakhs for the regular faculty, 1.5 lakhs for the postgraduate and super specialty students, and 50,000 for the undergrads. In terms of the institutional ethics committee, we have a ICMR and GCP standard compliant ISC that is registered both with the DCGI and with the DHR NATIC portal. So during the year 2023-24, we had a total of 26, that is full and subcommittee meetings. So this was the level at which we were meeting, and I would like to draw your attention, as ma'am said, we've reviewed 930, which is up from 297 proposals that were being evaluated earlier. So this is a jump of more than 3 times that were evaluated by the IC. We had a lot of critical comments, critiques were there. We are absorbing all the comments, we are trying to improve, and we are also proposing another ethics committee to handle the increased load. And this also reminds me of a Bandcamp album. We have an institutional ethics committee of 15 members. So this album was like Unsung Heroes, 15. So our members of the institutional ethics committee are more like the unsung 15 that usually, you do not get acknowledged for this thing. So amongst the faculty and student contributions, So we have the award categories, and why these award categories are in terms of publications, because this is reminding me of William Deming's quote, "In God we trust, all others bring data." So as data science is coming up, as huge data is coming up, data mining is there, artificial intelligence is there, we have to contribute in terms of meaningful data, data that can be used and can be helped, developed in terms of collaboration. So this is the list of the faculty awards. I'll not go into the details, but give you a bird's eye view. We had a total number of 199 entries, of which 91 entries were eligible and would be given different certificates of eminence, acknowledgement, appreciation. We also introduced a logo design contest this time, and we are awarding the 3 best prizes this time. This is the list of faculty members who have figured in the 2% global scientists as per the Stanford Assessment 2024. As I said, amongst the logo design contest for the research cell, we had an overwhelming response. We had a total of 17 entries, and out of these 17 entries, these were the 3 logos which are basically shortlisted for the research cell. And I thank all the students. It was open for everyone, right from the level of faculty to the students. So these were the 3 best logos. We would be awarding them in the research showcase. As far as the other ongoing initiatives and activities are concerned, this is the EIRB, as ma'am was talking about, that has been digitize, maintaining our online digital platforms. But we have not made it mandatory for the faculty as of now to submit everything online. So we intend to make it mandatory for the faculty from 1st of February. So this would be, we'll have an overlap. That is the period of January 2025, so that it is not inconvenient for the investigators to have a sea change between the papered submission and the paperless submission. So we are amongst the few institutes in India, rather, as Dr. Rishi would also agree, one of the first institutes in India to have a IPR policy on board besides the ICMR. So we were the first ones to have that, and to execute the same, we have a functional intellectual property management committee, and this management committee takes care of all the submissions that are being done, the vetting that is to be taken into consideration. We have the Authenticate software. This time we have introduced a new review process to prevent unauthorized access, which might lead to a early exhaustion of the credits that have been granted by the Authenticate. This time we felicitated the outgoing IC members. The term ended on 9th March 2024. These were the members, our chairperson, Professor Alok Dhawan, and the other members and staff of the research cell. So coming on to the last few slides, a recap of our Research Showcase 2023. So this was the oration was given by Professor Anita Mahadevan. She delivered the Professor Devendra Gupta oration titled Brain Bank, a Gift of Hope. So what are the future initiatives and activities that we plan? So the first one is the revised organogram of the research cell has already been approved by the Executive Council. We have the subsections in the form of Vice Deans, Research, Vice Dean Ethics to enlarge and delegate the duties. We have already conducted the interview to have 2 clinical study managers in the research cell so that we have technical support at hand. The organogram has been revised to have 3 basic sections: the research section, the account section, and the ethics section. and each being manned by individuals so that they have that kind of the sense of responsibility of holding the portfolio. All submissions as reviews to be done online. The new e-content is in place. New SOP will be enforced by 31st of March 2025. Sugam portal reporting is now being done dedicated at a separate email ID. The Data Safety Monitoring Committee and the independent review managers functioning as was discussed, it has been applied to monitor the intervention-based investigator-initiated research projects. So as far as the future plans are concerned, after the ethics work is done, we plan to digitize the research cell, form the second institutional ethics committee, IC accreditation to be looked into, an amalgamation of different pillars or domains. Last but not the least, I need to acknowledge the chairman members of the IC, the reviewers of the Professor Dhaven Kumar Young Investigator Gold Medal, best publications, PhD thesis, past office bearers of the research cell, the vice deans and staff of the research cell, finance office and registrar office, office of the Honorable Vice Chancellor, and last but not the least, the Honorable Vice Chancellor. I thank you all. This is the staff at the research cell that we have. We are proud of them. So would thank you, and we'll keep on learning based on the codes, whatever mistakes we have been doing, and try to correct that so that things are executed smoothly in future. Yep. Thank you so much.
I think wonderfully quoted, in God we trust and all others bring data. Thank you, sir, for your comprehensive presentation, ambitious yet pragmatic plans to elevate KGMU standing in the global community. And we have with us Dr. Shelly Awasthi, ma'am, Honorable Vice Chancellor, Bodhisattva University, Barabanki. We extend a heartfelt welcome to you, ma'am. Please. Dr. Neeraj, to please felicitate, ma'am. Thank you. Moving ahead, ladies and gentlemen, at the behest of Professor Dhaven Kumar, consultant in clinical genetics at the Institute of Medical Genetics, University Hospital of Wales, United Kingdom, it is my great honor to announce the recipient of the prestigious Professor Dhaven Kumar Young Investigators Gold Medal 2023. Instituted in 2012, this award celebrates exceptional contributions to clinical and applied research. As always, this year, the selection process was guided by the UGC guidelines as detailed in the Gazette of India 2018 and updated in 2023. Candidates were rigorously evaluated by esteemed jury, ensuring the highest standard of fairness and excellence. And it gives me immense pleasure to reveal that this year award is conferred upon Dr. Shalini Tripathi, Additional Professor in the Department of Pediatrics at King George's Medical University. I now invite Dr. Shalini Tripathi to take the stage and share her journey, insights, and contributions that have earned her this well-deserved recognition.
Thank you very much, Dr. Pragya. So, a very good morning to everyone present here, respected teachers, invited faculty, my seniors, juniors, colleagues. I am Dr. Shalini Tripathi, and I am Additional Professor in Department of Pediatrics, KGMU, and I am really grateful and blessed to receive this prestigious award. I will be presenting a short journey of myself. I have done my MBBS from GSVM Medical College, Kanpur in 2002, followed by MD Pediatrics for 3 years in KGMU, Lucknow, and joined this prestigious institute in 2013 as assistant professor. My area of interest are neonatology, inborn error of metabolism, and genetics. At present, I am subject expert in GI-AID Department of Health Research, DCGI India, also of resource faculty in State Resource Center, Facility of Newborn Care in UP State. I am also master trainer in many newborn trainings which are being conducted from KGMU. I have total 88 publications, which includes 4 book chapters, total citations of 428, out of which 60 are cited this year, H index of 10, and my highest citations are from my MD thesis, which was published in 2009, and which constitute to 1/4 of my total publications, which was in VAP in NICU, in KGMU NICU in 2006. I have my publication and the highest publication in a journal with an impact factor of 5. I am PI in many of the funded projects, which include WHO2, ICMR Multicentric Project 2, Department of Health Research 1, DHR MRU 1, Harvard University 1, ICMR Community Empowerment Lab 1. I am very thankful to the research cell KGMU for the very beginning for initiating research thrive in myself, and I received intramural project grant in 2015. My thesis candidate received an intramural thesis grant, and this paper was published in a journal and cited in Infant of Diabetic Mother section of Up to Date. And also at present, I am doing a project on a biomarker to predict asphyxia outcome in the asphyxia management, which is funded by DHR MRU. My main study area on which I am doing study is the birth asphyxia. Why have I selected this topic? Because among all the babies who die, perinatal asphyxia after prematurity and sepsis constitute the most important cause of mortality and morbidity. Of all the babies who survive, 50 to 60% they have delayed outcomes, and early prediction is very crucial. So I am working on something which is called a cerebral function monitor or amplitude integrated EEG, which is a machine which actually monitors the brain of the babies in the NICUs, which is very commonly used in the Western ICUs, but not in India. And the studies on this was scarce. So I basically planned a study of role of this cerebral function monitor in the prediction of the neurodevelopmental outcome of birth asphyxia neonates at 18 to 24 months of age. Applied for an extramural grant and which got accepted in 22, on which I am doing my PhD study, and which study is also going. Along with this particular thing, I am also studying on these babies the various biomarkers, which includes granulocyte macrophage colony stimulating factor and interleukin 8 in prediction of the same babies, the short term and the long term. I have enrolled 192 babies and following them up in the follow-up clinics by the standard test in which I am trained myself, DASI test, which I have done myself training at KEM Pune. So basically these neonates, I am trying to develop a prediction model by doing amplitude integrated EEG, MRI brain, biomarkers, and a kind of model that can predict the neurodevelopmental outcome of these babies at 18 to 24 months of age. Along with that, there are 2 other studies on the therapeutic options by a phase 2 trial of a drug which is used for adult stroke, solvitide, on these babies is going on, and also doing therapeutic hypothermia on selected babies, and to see how this affects the outcome as compared to the normal treatment as we do. So the preliminary data has been generated, and I will not present here, but it has been submitted and it is accepted in the reputed PASS conference to be for a presentation in 2025. So this is the neurodevelopmental follow-up by DASI being done in the pediatric follow-up clinic by myself and psychologist. The second area is that in the NICU we are struggling to diagnose many undiagnosed, drowned up inborn errors of metabolism and syndromes. And I'm very happy to share that in NICU we are now diagnosing, apart from the clinical, the genetic diagnosis of many such babies, which is helpful in the further pregnancies if they want to do the prenatal testing, and are published in reputed journals. So my long-term vision by this study is to make a prediction model of these to predict the neurodevelopmental outcome of HIE neonates so that the early intervention can be done, and also to establish a multidisciplinary team to care and follow up of the very sick babies admitted in an ICU KGMU. Thank you very much. I pay my gratitude to God, parents, my teachers who are sitting in front of me, my patients, and KGMU for all the work I do. Thank you very much.
Thank you, Dr. Shalini. Let's give her a big round of applause for this prestigious honor. Coming on to the next prestigious award, the Best PhD Thesis Award. Dr. Shipra Karthik as the recipient of the prestigious Best PhD Thesis Award. This research carried out under the expert mentorship of Professor Rishi Pal in the Department of Pharmacology and Therapeutics reflects an exceptional academic excellence. Out of the 6 exceptional theses evaluated by a distinguished panel of external juror, Dr. Shipra Karthik work on role of autophagy and necroptosis in pathogenesis and their modulation by pharmacological agents in Parkinson's disease emerged on as the finest. I now invite Dr. Shipra Karthik to share the highlights of their remarkable work.
ये वाला
A very good morning to all the respected dignitaries and seniors, faculty members. I am Dr. Shipra Karthik, presenting my research work and feel immense pleasure and heartfelt gratitude to my supervisor and research cell for providing me this opportunity to show my research work. My PhD research work was entitled as Role of Autophagy and Necroptosis in Pathogenesis and Their Modulation by Pharmacological Agents in Parkinson's Disease. This work is sponsored by ICMR SRF under the supervision of Professor Rishi Pal sir and co-supervision of Rajendra Nath. This work is focused on Parkinson's disease, as we all know that it is the second most common neurodegenerative disorder and also characterized as a movement disorder. It is basically characterized by a hallmark characteristic of presence of dopaminergic neurodegeneration and the presence of Lewy body formation due to the dopamine decline and different protein aggregations such as alpha-synuclein. It characterized by several symptoms such as rigidity, tremor, bradykinesia, cognitive declines, and so on. There are major factors which conclude the pathogenic mechanism of PD, in which programmed cell death is one of the demise that regulate the dopaminergic neurodegeneration. As we all know that cell death is the utmost characteristic of any cells, but it is also a programmed or regulated one, and it is categorized in apoptotic and non-apoptotic one. My work was focused on non-apoptotic cell death, that is autophagy and necroptosis. Recent years, autophagy is regulated as a cell survival phenomena, but some research conclude that it is also a pathogenic mechanism that can lead to the cell demise or a pathogenic mechanism of any kind of disease, as it induces oxidative stress. As we know that nowadays oxidative stress is one of the major pathogenic factor of any kind of disease such as neurodegenerative disorder and this PD model. This pathogenic mechanism may regulate by different cell types, different pathogenic stimuli, and it is a characteristic that it may regulate the cell survival phenomena or a pathogenic phenomena. Next, it also concludes to the second one, cell death phenomena, that is a necroptosis, called as regulated necrosis, that is a mixture of a necrosis and apoptotic form of cell death. For this, we used MPTP intoxication PD model for the in vitro and in vivo studies. Such as in vitro studies, we use the pheochromocytoma cells with MPTP intoxication and Balbsi mice, which has resemblance with the aging mice feature, and we conclude the our work in the determination of what is the role of autophagy, either it is a proliferative one or a survival phenomena, what is the crosstalk of autophagy and necroptosis, and how their modulators regulate the pathogenic mechanism and can be used as a preventive mechanism. So novelty is that, as we all know, that it has symptomatic approaches, and the main medications for PD is approaches of restoration of dopamine decline. But some disease-modifying therapy are urgent need for the current demand of any kind of disease progression, their regulation, and for their prevention. This study provides the new dimension about the autophagy, that either it may be a cell survival or a pathogenic, or how it contribute to the necroptotic cell death of dopaminergic neurodegeneration in PD brain. This is the hypothesis of my study, as when Lewy body formation, that is alpha-synuclein aggregates in substantia nigra region of Parkinson disease occurs, it may regulate two types of cell survival phenomena. One is autophagy, that is the engulfment of cell debris through formation of autophagosomes, or it may lead by the lysosomal dysfunction that may cause the autophagosome impaired production. So it can be two types of phenomena, either it is a cell survival or a cell death. So with the use of autophagy inducers, we enhance the cell survival phenomena, and with the use of autophagy inhibitors, we reduce this pathogenic mechanism. So my work focused on the use of these modulators so that we can prevent the Parkinson disease, and not only symptomatic approaches, but also on the disease progression level. These are the cardinal results of my research. Firstly, we established that if there is a possibility of autophagic pathogenic mechanism or a necroptotic in PD model or not. For this, in vitro study, we determined the PC12 cell, a pheochromocytoma cell, for the MPTP intoxication. MPTP is a well-known neurotoxin which is used for MPTP resemblance, and acute dosing of this is used for the production of a PD model in PC12 cells. For this, we determine the cell viability and production of ROS, that is a reactive oxygen species, with different assays, which shows that MPTP intoxications markedly enhances the intoxication or degeneration of dopaminergic neurons. For assessment of necroptosis, we gone through the FACS analysis of flow cytometry, and here we can see that coordinate Q3 shows that segregation of cells, that shows the necroptotic parameter, and it shows that MPTP intoxication 20 times increases the cell death. And for autophagy assessment, acridine orange staining were done, and all these yellow stain shows that there is a presence of autophagic vacuolization. Next, after in the in vivo studies, we have gone through the BALB/c mice. For this, as this is decline of dopamine and tyrosine hydroxylase, which is the biosynthesis enzyme for the dopamine production. Both are declined in this PD model, and here we can see that in our model, dopamine and tyrosine hydroxylase both are markedly declined by MPTP. And after that, different biomarker proteins of autophagy and necroptosis were assessed by Western blotting, here we can see that on MPTP intoxications, LC3B, a light chain kinases B, autophagic marker, and receptor interacting protein kinases, necroptotic marker, both are enhances, whereas tyrosine hydroxylase, the dopamine precursor enzyme, is declined. So after establishment of this model, we have gone through the different use of different modulators, such as autophagy inducers like niclosamide, glycyrrhizic acid, and inhibitors like chloroquine and 3-methyladenine. We can see that RIPK1, a necroptotic marker, enhances markedly by MPTP intoxication through Western blotting and immunofluorescence assays, whereas autophagy inducers give slight response on pathogenic phenomena, and autophagy inhibitors, chloroquine, shows markedly response and markedly reduce the MPTP intoxication. This is a movement disorder, so different neuromuscular strength and motor coordination were also assessed through different parameters, which show that chloroquine have more protective one. We have gone through the dopamine content and different biochemical enzymes such as antioxidant and MDA level, which also declined and normally restored by chloroquine use. And when we go through the neuroinflammatory signaling, we have gone through the IL-1 beta and TNF alpha estimation through ELISA. It shows that chloroquine and glycyrrhizic acid both have anti-neuroinflammatory consequences. Through immunofluorescence, we have gone through the different marker proteins such as tyrosine hydroxylase, LC3B, and RIPK1, which shows that chloroquine have utmost preventive response rather than the inducers. So we can see here in summary that acute MPTP intoxication lead to the autophagic pathogenic mechanism, which also regulate the necroptotic phenomena, and use of inhibitors is main preventive mechanism for the PD pathogenesis. And we can go through the autophagic modulators in the inhibitors forms rather than autophagy inducers one. This research show that a main premises which is used as a dopamine restoration, we have to focus on the disease modifying therapy, and use of autophagy modulators should be optimized, and what should be used is also regulated one. These are my publications in movement disorder with different impact factors, and Springer's Village journals with SAGE publications. These are my abstracts. Different awardees, I have gone different travel grants with 1,000 to 500 USD with different international bodies from Movement Disorder Society, International Brain Research Organization, and European Academy of Neuroscience in different years. Lastly, I would like to acknowledge VC ma'am, my supervisor, my head of department, my co-supervisor, and my all doctoral members for their heartfelt support and guidance. Thank you.
Let us all applaud this outstanding success and take inspiration from this exemplary work. Thank you. Thank you, Dr. Shipra Karthik, and congratulations to both awardee and the mentor. So now, awards are a meaningful way to honor exceptional achievements, recognizing the dedication, hard work, and innovative spirit that individuals bring to their field. With this, I request our esteemed dignitaries to kindly step forward to present the awards. As I call upon each awardee, please be prepared to receive the award and from one side and exit from the other side for a smooth running of the event. So the first honor of the event is the Professor Dhaven Kumar Young Investigators Gold Medal. May I now request Dr. Shalini Tripathi to step forward and accept the honors. Many, many congratulations, Dr. Shalini. Next, I call upon Dr. Shipra Karthik and her guide, Dr. Rishi Pal, for the Best PhD Thesis Award. Coming on to the felicitation of an outstanding undergraduate research. For this, please join me in welcoming Ms. Shivangi Singh to receive this distinguished award. Shivangi Singh, a final year BDS student at King George's Medical University. She has received prestigious accolades including the Sri Akhilesh Kumar Mishra and Sri Ajay Kumar Gold Medal and a book prize for academic excellence. She was awarded the 2023 ICMR STS Fellowship for evaluating the quality of dental care provided by the aspiring dentists. Shivani Singh is the winner of the 2024 IADR David B. Scott Fellowship, recognizing globally for her outstanding contributions to research academic excellence. We congratulate her on her exceptional journey. Today, as we celebrate the achievements of KGMU faculty members who have earned distinguished positions in the Stanford Global Ranking for 2024. So these individuals have elevated our institution's stature on the global academic stage. Please join me in congratulating, first and foremost, Professor R.K. Garg sir, Head Department of Neurology, holding the impressive rank of 28,178. Next, Dr. Sujit Kumarkar, Additional Professor in the Department of Psychiatry, positioned at rank 47,878. Many, many congratulations to Dr. Sujit. So let's give him a big round of applause. Next, we have Dr. Shaili Avasthi Ma'am, Vice Chancellor, Bodhisattva University, Barabanki, former Dean Research and Head of the Department, Pediatrics, KGMU, with a notable rank of 1,09,199. Calling Dr. Shailen K. Saxena, Professor at Center for Advanced Research, securing a position at 1,15,028. Next, may I have the honor to invite Dr. Abbas Ali Mehndi Sir, Vice Chancellor at Era University, Lucknow, holding a commendable rank of 1,65,486. Next, please join me in felicitating Amita Jain Ma'am, Head Microbiology Department, with a rank of 1,66,000. Dr. Rajesh Verma Sir, Professor in the Department of Neurology, achieving a rank of 1,94,923. Can we now please have Dr. Rashmi Kumar, former Head of the Department of Pediatrics, with a distinguished rank of 2,89,774. And last but not the least, Dr. Suryakant, Head Department of Respiratory Medicine, ranking 3,21,681. So a big round of applause for these recipients of international honors. Now we move on to the much awaited award segment, which recognizes the outstanding research contributions by our faculty and students. This year, we proudly received an impressive total of 199 entries across various preclinical and clinical categories, as well as the other domains. The award for eminence in research will be presented to the recipient with highest impact factor, while others will receive a certificate of eminence in research. So let us commence with the announcement of the winners, beginning with the first category, the preclinical category. Dr. Shailen Kumar Saxena, Professor, Center for Advanced Research. He receives the award for eminence in research and a cash award for his work on novel belladonna formulation against Japanese encephalitis virus. Dr. Ashutosh Srivastava from the Department of Center for Advanced Research, he procures certificate for eminence in research and a cash award for his paper on severe obstructive sleep apnea, measuring the urinary metabolite signatures reflecting the altered host metabolism. Dr. Sujit Kumar Kar from the Department of Psychiatry, he receives a certificate for eminence in research for his commendable work on how sensitive are the free AI detector tools in detecting AI-generated text, a comparison of popular AI detector tools. Thank you. Moving on to the second category, Prada Clinical category. For this, I want to invite Dr. Satyendra Kumar Singh from the Department of CFAR, who receives the award for eminence in research and cash award for his exemplary paper on anti-tumor efficacy of synthesized silver-gold nanocomposites loading with PEG and ascorbic acid in human lung cancer stem cells. Dr. Geeta Yadav, I think Dr. Wahed Ali is going to collect her award, a recipient of certificate for eminence in research and cash prize for paper titled Humoral and Cellular Immune Response in Patients of Liver Cirrhosis and Immunocompetent Recipient of Covishield Vaccine. Inviting Dr. Parul Jain from the Department of Microbiology, who receives the certificate for eminence in research and cash award for her paper publication titled High Frequency of Isoniazid and Fluoroquinolone Resistance Among Patients with Rifampicin-Sensitive Tuberculosis. And the final award in this category goes to Dr. Riddhi Jaiswal from the Department of Pathology. She received certificate for eminence in research for her work on microvessel density, cluster of differentiation and vascular endothelial growth factor in nasopharyngeal angiofibroma. Next, we have the clinical medical category. For this, I invite Dr. Manish Kumar Mannar from the Department of Community Medicine and Public Health Department. He receives the award for eminence in research and cash award for his interesting paper titled Statistical Estimation of Noise-Induced Hearing Loss among the drivers in one of the most polluted cities of India. Then we have Dr. Neeraj Kumar from the Department of Neurology. He is recipient of Certificate for Eminence in Research and Cash Award. His paper is titled Utility of Itraconazole in Combination with Liposomal Amphotericin B, an Exploratory Study. Dr. Ajay Kumar Patwa from the Department of Medicine. He received Certificate for Eminence in Research and Cash Award for his paper titled Comparison of Novel Score to Other Established Prognostic Scores for Prediction of Mortality, a cohort study. Dr. Shweta Pandey from the Department of Neurology. She received Certificate for Eminence in Research and Cash Award for her paper, Neuroimaging Abnormalities in Patients with Subacute Sclerosing Panencephalitis, Prospective Follow-Up Study. Can we now have Dr. Arisha Alam from the Department of Pediatrics for receiving the Certificate for Eminence in Research and Cash Award. I think Dr. Shalini is receiving. Dr. Arisha is not here. Clinical spectrum and prognostic markers of multi-system inflammatory syndrome in children hospitalized in northern India. Next we have Dr. Ravi from the Department of Neurology. He receives Certificate for Eminence in Research and Cash Award for his publication, Occurrence and Determinants of Seizure and Their Impact on Tuberculosis Meningitis, a Prospective Evaluation. Calling upon Dr. Amit Singh from the Department of Psychiatry. He received Certificate for Eminence in Research. His publication is titled Randomized Controlled Trial of Bifrontal Transcranial Direct Current Stimulation on Cravings and Alcohol Use Disorder. Can we now have, can we have Dr. Sujit Kumar Kar from the Department of Psychiatry. He receives the Certificate for Eminence in Research for his very interesting work on transcranial direct current stimulation as early augmentation in adolescent obsessive compulsive disorder, a pilot proof of concept, a randomized controlled trial. May I now have the honor to invite Dr. R.K. Garg, sir, Head, Department of Neurology, who receives an incredible number, 7 Certificate of Eminence and 3 Certificate of Eminence along with Cash Award for his publications. His published work are mainly systematic reviews titled as Seizures as Presenting Feature of Subacute Sclerosing Panencephalitis, The Spectrum of Psychiatric Manifestation in Subacute Sclerosing Panencephalitis, and many more. Moving forward. Now we have Dr. Rishi Pal from the Department of Pharmacology. He received Certificate for Eminence in Research and a Cash Award for his study, Artificial Intelligence Revolutionizing Drug Development, Exploring Opportunities and Challenges. This is a review article. Let's now proceed to the next, which is the clinical surgical category. Dr. Shefali Gautam from the Department of Anesthesia and Critical Care. She receives for Eminence in Research and Cash Award for her interesting work on efficacy of short blocker device versus vapocoolant spray for spinal needle pain relief during spinal anesthesia, a randomized controlled trials. Calling upon Dr. Manjulata Verma from the Department of Obstetrics and Gynecology. She receives the Certificate for Eminence in Research along with a Cash Award for her work titled Comparison of Acceptability, Efficacy of Thermal Ablation and Cryotherapy in via positive cervical lesions. Can we have Dr. Pooja Ramakant from the Department of Endocrine Surgery? Thank you, ma'am. She received Certificate for Eminence in Research and Cash Award. Dr. Dharmen Kumar from the Department of Orthopedic Surgery. He receives the Certificate for Eminence in Research, and his work is titled Incidents and Risk Factors Associated with Surgical Site Infection in Acetabular Fracture Patients and Experience from North India. Up next is the dental category. Dr. Saumen Vikram Singh from the Department of Prosthodontics receives the Award for Eminence in Research and a Cash Award for his paper published in a high-impact journal entitled Comparing Color Match by Conventional Trial and Error Method with Maxillofacial Spectrophotometer Method for the Skin of Indian Participants. Thank you, Dr. Saumen. Next, we have Dr. Balin Pratap Singh from the Department of Prosthodontics, and he receives a Certificate for Eminence in Research for his work on the effect of food supplements on complete dentures, a randomized controlled trials. Dr. Shalini Gupta from the Department of Oral Pathology and Microbiology. She received Certificate for Eminence in Research and Cash Award for the review article titled Unraveling the Genetic Web, HRAS Expression and Mutation in Oral Squamous Cell Carcinoma, a Systematic Review. Time to recognize achievements in paramedical and nursing faculty category. Mrs. Sudha Mishra from the College of Nursing. Okay, she is here, and she receives Award for Eminence in Research for her work on compulsive drinking behavior, anger, and self-esteem among patients with alcohol dependence syndrome. Up next is the PG student category, that is the postgraduate students. Can we have Dr. Akshi, junior resident from the Department of Prosthodontics. Do you want to receive on behalf of Akshi? Yeah, please come. Okay. Dr. Raghuvar, you can also come. Okay, she receives the award for eminence in research for her work on compulsive drinking behavior. No, her work on a technique for fabricating custom translucency tabs for the aesthetic imitation of sclera in an ocular prosthesis. Next, we have Dr. Ankita Saroj from the Department of Psychiatry. She received certificate for eminence in research for her work on psychiatric comorbidities and profile of patients with irritable bowel syndrome on northern India. Inviting Dr. Abhishek Bhattacharya, the senior resident in pediatric and preventive dentistry. He receives a certificate for eminence in research titling Comparative Assessments of Cleaning Efficacy of 2 Exclusive Pediatric Rotary Files in Root Canals and Primary Teeth, which is an in vitro study. Dr. Shilpi Gupta from the Department of Periodontology. She receives certificate for eminence in research to evaluate the relationship of obstructive sleep apnea with chronic periodontitis and its association with coronary artery disease by assessing serum tumor necrosis factor alpha. I think the next exciting category is the undergraduate student category. So undergraduates of KGMU are not proving that they are no less shining bright and making us proud. So can we have Dr. Subhajit Roy, intern MBBS 2019 batch. He receives the Award of Eminence in Research for his work on prospective case control study of disability, quality of life, functional impairment of shoulder movements. His work is on the breast cancer patients. Thank you, Subhajit. Next, we have Dr. Vibhor Agarwal from the Department of Psychiatry. He receives certificate for eminence in research for his work on the digital health dilemma, exploring cyberchondria, well-being, smart for addiction in medical and non-medical undergraduates. The need for the hour. Next category, the best paper published from intramural grant in the last 3 years. For this, can we have Dr. Anand Pandey from the Department of Pediatric Surgery, and he is recipient of Award for Eminence in Research and Cash Award. His work is on analysis of the efficacy of elastography in comparison with dynamic renal nuclear scintigraphy in the evaluation of unilateral pelvic-uteric junction obstruction. Thank you, Dr. Anand. Next category, we have exceptional research, research travel, and research fellowship category. Can we have Dr. Shalini Gupta, the head department of oral pathology and microbiology? She receives an incredible number for 6 certificate of acknowledgement for patent and copyrights. Her 2 patents are jaw-opening device for diagnostic inspection and modification of staging of root pulp sensibility, and her copyrights are grading the subepithelial in odontogenic keratocyst. Next, we have Dr. Fahad Mansoor Samdi from the Department of Oral Pathology and Microbiology, and he receives a certificate of acknowledgement for his work, a multicentric survey. It's a copyright, a multicentric survey-based study of dentists on evidence-based dentistry in Uttar Pradesh. Again, we have Dr. Sujit Kumar Kar from the Department of Psychiatry, and he receives a certificate of acknowledgement for his Oration Award, that is the BB Oration Award. He also receives a certificate of acknowledgement for Saransh Grant Aid. Can we have Dr. Balin Pratap Singh from the Department of Prosthodontics, who receives a certificate for acknowledgement on the Saransh Grant 8, which is a systematic review and networking support in health grant to train faculty members and healthcare institutions in UP and UK in systematic reviews and meta-analysis. Can we now have Dr. Ridhim from the Department of Conservative Dentistry and Endodontics, who receives 2 certificates for acknowledgement for her patent and for her femur fellowship. Can we have a big round of applause? Okay. So next, we have myself, Dr. Pragya, from the Department of Conservative Dentistry and Endodontics, and a certificate for acknowledgement for a fellowship on International College of Dentists.
Thank you, Dr. Pragya. Next awardee is Dr. Diksha Singh, Department of Oral Pathology and Microbiology, and she is getting certificate of acknowledgement for patent on improved Lactan carver.
Thank you, Dr. Diksha. Next, we have Dr. Nishi from the Department of Conservative Dentistry and Endodontics, and she receives 3 certificates of acknowledgement for her fellowship awards, the International College of Dentists, the Perry Fortune Academy Fellowship Award, and also an award for 3rd Best Oral Presentation at Cochrane India Conference. Dr. Vidya KL from the Department of Geriatric Mental Health. Do we have Dr. Vidya? Next, we have Dr. Sharon John, Senior Resident from the Oral Pathology and Microbiology Department, and she receives a certificate of acknowledgement, classification of calcifying odontogenic cysts, which is a paper presentation, a novel outlook on classification, diagnosis, management. Next, we have Dr. Saloni Verma, Junior Resident in Department of Oral Pathology and Microbiology, and she receives 6 certificates of acknowledgement, and her acknowledgement are of a scientific paper presentation, 2nd prize, then again a 3rd best scientific paper presentation, and she has 1 patent and 2 copyrights. Very well done, Dr. Saloni. And now next we have Dr. Ayushi Jain. She receives 3 certificates of acknowledgement for securing 3rd position for paper presentation on role of HIF alpha in ameloblastoma, a systematic review at a national PG conference at DY Patil. She also has a patent and a copyright. Next we have Dr. Faiz Abidi, Junior Resident from the Department of Pharmacology, and he gets the acknowledgement for getting selected for the incubation program at STPI MedTech COE at Sanjay Gandhi Postgraduate Institute of Medical Sciences in the year 2022. The next exciting category is the Research Quiz Award. The Research Quiz Award, witnessed enthusiastic participation with 53 registered participants. The quiz comprised 25 thought-provoking questions testing the participants' grasp on the subjects. So announcing the winners, top scorer is Manikya Verma from the MBBS 2020 batch. He receives an award certificate. And can we have the runner-ups, that is Soumya Mishra from Paramedical 2022 batch and Pragati Jha MBBS 2021 batch. I think Dr. Pragati is not here. Moving ahead, this time we have an interesting category as told by Dr. Hardeep Malhotra, the Logo Awards. And the winners, the first winner of the Logo Award is Dr. Sakshi Uswal. Can we have Dr. Sakshi? This is the Creative Award. And next we have a faculty, Dr. Noor Sabah from the Assistant Professor of the Department of Anatomy, who stands at the second position in this Logo Award. Next, I call upon Dr. Jyotika Preeti, a junior resident in oral pathology and microbiology, who receives a certificate of appreciation for the Logo Award. Dr. Shalini is receiving on Dr. Jyotika's behalf. With this, we conclude the award distribution ceremony. Thank you, dignitaries. You all may please take your seats in the gathering. And these awards will surely serve to inspire and guide the next generation of researchers and scholars. It's time now for the release of academic and research books authored by the esteemed faculty of King George's Medical University. Each book represents a milestone of dedication and knowledge sharing, and we are proud to celebrate these achievements. Although we couldn't release these books on the Foundation Day, today as a part of Research Showcase, it feels more fitting to unveil this significant contribution. So, as I announce the names, I request the authors to kindly step down, come forward and stand behind the dignitaries. Meanwhile, a slide presentation highlighting the titles and details of publication and publisher will play in the background. Can we have Dr. Dhruv Nigam, Dr. Vishwajit Singh, Dr. Sujit Kumarkar, Dr. Vibha Singh, Dr. Anurag Rai, Dr. Sarita Singh, Dr. Dikshit, Dr. R.S. Gangwar, Dr. Ajay Kumar Verma, Dr. R.K. Dikshit, Dr. Pramila Verma, Dr. Rhythm Bains, Dr. Rakesh Kumar Yadav. Can we have Dr. Ramesh Bharti, Dr. Pragya Pandey, myself, Dr. Vijay Kumar Shakya, Dr. Pooja Singh, Dr. Umesh Pratap Verma, and Dr. Rekha Sachan. Okay, I think. So we all will group follow. Yeah. Okay.
Nigam is an undergraduate student, and he is not available to the.
Thank you all authors, and let's give a big round of applause to all authors for their remarkable contribution, and thank you to the dignitaries for their support for celebrating this proud moment with us. Congratulations once again to all the awardees. Adding to the excitement as previously announced, the awardees in the publication category will also receive cash prizes as token of recognition for their outstanding contributions. Let me now share the details of these cash awards. The cash awards are categorized as follows: Rupees 10,000 for participants with an impact factor above 10, Rupees 5,000 for participants with an impact factor above 5, and Rupees 2,000 for participants with an impact factor above 2. Okay, moving on. The pinnacle of our program approaches as we anticipate Keynote oration, the Professor Devendra Gupta oration, to be delivered by our esteemed chief guest, Professor Sudeep Gupta. I now invite Dr. Amita Jain Ma'am, Dean of Academia, to present a brief overview of the illustrious and decorated career of our esteemed chief guests.
Thank you, Pragya. Professor Sudeep Gupta. I'm feeling really like जैसे सूरज को दिया दिखाने वाली feeling हो रही है. But this is a task and it has to be done. So just on a very formal note, Professor Sudeep Gupta is Professor of Medical Oncology and Director of Tata Memorial Center, Mumbai. He did his MBBS, MD and DM from All India Institute of Medical Sciences, and after completing his studies, he became the faculty in Department of Medical Oncology at Tata Memorial Center since 2001. He is an internationally renowned breast and gynecological cancer oncologist. He is a prolific clinical researcher who is actively involved in planning, organizing, conducting, and analyzing phase 1, 2, 3, and 4 clinical trials. He has, I think this needs an applaud, guys. He has more than 500 trials which he has conducted either as a PI or as a co-investigator. So that's a huge volume. He has a special interest, as I have already said, in breast and gynecological cancers. He has research themes on which he focuses are implementation science, including access to medications, guideline development, testing concepts and technology in clinical trials, innovative therapeutic strategies, toxicity and quality of life studies, pharmacokinetics and translational studies involving next generation sequencing technology. He has published more than 380 papers in peer-reviewed journals, and he is member of several national and international committees and task force from DBT, DST, ICMR, NITI, ESMO, etc. So, ladies and gentlemen, I present before you Professor Sudeep Gupta.
Honorable Vice Chancellor, Professor Nityanand, other distinguished personalities on the dais, distinguished faculty members, ladies and gentlemen. I bring you greetings from the hospitals of Tata Memorial Center. It used to be a single hospital institution until 2002, but now in 2024, we have 11 hospitals in 7 states of India. So I am actually not the director of Tata Memorial Hospital, which is one of those 11 hospitals. I am the director of Tata Memorial Center, which is the conglomerate of all those hospitals, but of course we also have unit directors. So before I begin, my profound gratitude to the King George's Medical University for the privilege and honor of the Professor Devendra Gupta Oration 2024. I have an old connection with the King George Medical College. My mother was a graduate of KGMC from the Dr. S.S. Agarwal's batch. So I grew up on a staple of KGMC. It used to be called the KGMC then. So thank you very much for having me here. In Latin, cogito ergo sum. In French, je pense, donc je suis. I think, therefore I am. Before you accuse me of changing my profession, this was said by the 17th century French philosopher René Descartes in his Meditations on First Philosophy. Can one ever be certain about the truths of any belief? The unreliability of our senses and reason can lead us to doubt every belief. If I think and doubt, I must exist. Descartes attempts to rebuild all human knowledge from this first principle and establish proof for the existence of, among other things, God. The epistemic lesson of cogito is that if certainty is a necessary requirement for knowledge, we are left with very little knowledge. The challenge, however, is that if certainty is not required for knowledge, then what is? This was memorably captured in this wonderful movie more than a couple of decades ago, The Matrix, and I believe some of you must have seen it. I have had the occasion to muse on the theme of uncertainty. This is an editorial that I wrote for the journal that I was the editor-in-chief of, and I will quote myself: "Human affect is deeply antithetical to uncertainty and probabilities. Our species is more comfortable with certainties, including discomforting ones like death. And average individuals like you and I are not alone in our distress. Albert Einstein, no less, famously lamented that God cannot play dice. As it turns out, God does play dice." So Descartes, apart from being a philosopher, was a first-rate mathematician, and he connected the previously separate fields of geometry and algebra into analytical geometry. And the Cartesian coordinates that some of us know about are named after him. So, ladies and gentlemen, I will present to you a few beliefs with the caveat that they do not satisfy Descartes' exacting standard of knowledge. My principal vocation in life has been to be a clinician and lately an administrator. It has been my privilege to mentor a few young minds and conduct some research. And because today is the Research Day function, I will share with you a few examples of what we have done in the past few years. So some of you know that the group of drugs known as platinums are useful anti-cancer agents in many cancers. One particular cancer is called triple-negative breast cancer. It is a particularly aggressive variety of breast cancer and is particularly prevalent in India. And believe it or not, the proof that platinum is effective or not in breast cancer was lacking until we presented this randomized control trial at the San Antonio Breast Cancer Symposium a couple of years ago. And I had the privilege of presenting it there on behalf of my colleagues from the Breast Cancer Working Group. So by way of background, I've already told you that although platinums have been around for a while, formal proof that they work and they improve outcomes in patients with triple-negative breast cancer had been lacking, despite a few phase 2 trials. So we conducted and analyzed a large definitive randomized control trial. These were women with triple-negative breast cancer with locally advanced disease. And after being stratified on menopausal status and clinical stage, they were randomized to either receive or not receive platinum in addition to standard chemotherapy as part of their neoadjuvant treatment, after which they underwent surgery, radiotherapy, and routine standard of care. The study accrued to its full sample size of 720, and each big definitive randomized trial is a baby that you have to nurture. You can see that it took 10 years for us to accrue a sample of 720 patients and follow all of them up for an average of 67 months. And so this is the patient characteristics, and the only reason why I put up this table in front of you is to show you that although these patients had non-metastatic cancer, they all had really locally advanced disease, which is not seen in Western countries but is very commonly seen in India and similar locations. So the primary endpoint of our study was event-free survival, and in cancer, survival is the gold standard endpoint. Whatever happens to the tumor under the microscope, whatever happens to the next generation sequencing results, for the patient and for the doctor, whether the patient lives or she dies is the most important outcome. So for the primary endpoint, the addition of platinum showed a 6.5% improvement in the 5-year event-free survival, but that was not formally statistically significant, as you can note with the p-value there. But when we broke up the results by age, in women younger than 50 years of age, there was a marked, substantial, statistically significant 12.5% improvement with the addition of platinum, whereas in older patients, there was no benefit whatsoever. And this is the forest plot that some of you might be conversant with. So there was an interaction. This is gamed as an interaction term when you analyze the data between age and the benefit of platinum and menopausal status and the benefit of platinum. And as you can see the p-value for interaction, that interaction was significant, which meant that for some biological reason, platinum benefits younger women, but it doesn't the older women. So this is overall survival. This is death due to any cause, the gold standard endpoint in cancer. Here, in the entire cohort, you can see there's a 7.5% improvement in overall survival that was statistically significant. Again, when broken down by age, a marked benefit in younger patients, but no benefit in older patients. And again, the test of interaction positive between age and the benefit of platinum and menopausal status and the benefit of platinum. So we concluded that the addition of platinum as a part of the neoadjuvant chemotherapy regimen improves the outcome of patients with triple-negative, locally advanced triple-negative breast cancer, but it does so only in younger patients and not in older individuals. So simultaneously, we also wanted to look at the life history, the biological life history of triple-negative breast cancer in individual patients. This is a study that we were funded by the Department of Science and Technology, and this is the work of my PhD student Nilesh Gardi, who successfully defended his thesis a few months ago, and this is published in the Journal of the American Association of Clinical Research, the Cancer Research Communication. So what we did was to take a biopsy of the tumor in individual patients throughout their life history, right from the time of diagnosis through several phases of relapse and disease progression right until their death. And some of you will appreciate that patients relapse not just in the skin or in the breast, they relapse in the lung, liver, and several locations. And so collecting a tumor at the time of each relapse through several waves of relapse right until death is an exceptionally difficult data set to collect and a sample set to collect. But we did it. We also collected the corresponding germline, and we subjected all of those samples to ultra-high depth sequencing, multi-omic sequencing that is listed at the bottom of that slide. And for reasons of brevity, I will not go into the details except to say that we conducted ultra-high depth DNA sequencing as well as RNA sequencing along with copy number analysis through SNP arrays. So these were the findings. So in all tumors, we found that the tumor mutational burden, the number of mutations per megabase, varied through the life history of that tumor within single patients. And we also found that mutational signature 3, which is the mutational signature of genomic instability or BRCA HRD, it persisted in all samples over time, So even from a sample taken just before the death of the patient, the mutational signature still showed the BRCA HRD signature. We also had collected the liquid biopsy of these patients throughout their life course. And you can see here the upper panels are the tumor mutations and the lower panel are the liquid biopsy. And the liquid biopsy actually presents a more complete picture of tumor compared with tissue biopsy at any given time point, and which is somewhat intuitive because mutations that come in the blood come from all sites of metastasis, whereas you cannot biopsy every single metastasis in a patient. Now, this was the heart of our study, and you can think of a tumor as an organism, and this is the mother clone or the principal clone that the tumor is comprised of. This clone actually persisted throughout the life history of a patient. The patient received several rounds of chemotherapy, several kinds of chemotherapy, radiation, other treatments, and as you can see, it gave off daughter clones that were given out, and then they became extinguished throughout the life history of these patients that we sampled. So this is called the branching evolutionary model for somatic mutations. So through this analysis, we got a relatively deep insight into the pattern of Darwinian clonal evolution of cancer and why it becomes resistant to several treatments over time. And we think that we can potentially devise new and smart ways of hitting cancer cells so that they don't escape. This is my other PhD student, Rohan Chaubal, and for a long time we have been interested in what surgery does to the tumor biochemically. So all of us think that surgical resection of the tumor is taking it out and throwing it not into the bin, but sending it to the pathologist. But actually we feel that the act of surgery, devascularizing the tumor over a period of about 1 or 2 hours, can induce biochemical alterations in the tumor. And so what we did was, we actually sampled the same tumor at the beginning of surgery, at the middle of surgery, at the end of surgery when it was completely resected, and we again subjected it to ultra-high depth RNA sequencing. And as you can see, and this was again published in Molecular Cancer Research, the Journal of the American Association of Clinical Research, and surgical resection actually deregulated several hallmarks of cancer, and some of you are aware of the Hanahan and Weinberg's framework of hallmarks of cancer that are unique properties of cancer that differentiate them from benign tissue. So the act of surgery is not just a physical act, it's a biochemical alteration of the tumor alongside being a physical act. And the reason is, if you think about it, when you operate, the tumor is fully vascularized, and at the end of the surgery, the tumor is out of the body, fully devascularized. So there is a rapid onset of hypoxia and hypoglycemia and other nutrients to the tumor in a span of about 60 to 90 minutes or whatever time it takes to perform the surgery. And so some of those alterations, some of the deregulated hallmarks can actually lead to metastatic potential among the circulating tumor cells that may be given out during the surgery. So we also devised a clinical trial to act on these results. And what we did was to randomize 1,600 women, half and half, and half the patients in the interventional arm actually got a local anesthetic called lidocaine injected all around their tumor just prior to surgery, and the control patients underwent usual surgery without this infiltration. And if some of you ask as to why we chose lidocaine, it is a potent blocker of voltage-gated sodium channels that we believe are involved in the deregulation of several hallmarks of cancer. And then these patients received the routine post-operative treatment and were followed up for about 7 years on an average, and these are 1,600 patients who were randomized. And as you can see, this was published in the Journal of Clinical Oncology last year. On the left is disease-free survival, on the right is overall survival. Both of them are substantially, clinically and statistically improved by the simple act of infiltration of lidocaine all around the tumor just prior to surgery. And in the bottom panel on the left is local recurrence, on the right is distant recurrence, and both of them are also substantially and significantly reduced by a simple intervention that costs only about 100 rupees. And this, our article was accompanied by an editorial from Dr. Mittendorf from the Dana-Farber Cancer Institute, and she said that it seems reasonable to introduce this intervention as an easy, cost-effective intervention that may reduce the rates of recurrence and death in women with early-stage breast cancer. So the kind of research that our group conducts is not just esoteric research. Of course, blue sky esoteric research is also very important, but because I am a clinician, because most of our group members are clinicians, we try to conduct research that may improve the lives of our patients. So something was said about synthesis of evidence in the Cochrane group. So I will tell you about a couple of meta-analyses that we recently did and actually pioneered a technique to do it. And in passing, this Dickens masterpiece is a personal favorite. So Dr. Seema Gulia is my colleague from the Department of Medical Oncology. Sadhna Kannan is a top-class statistician in Tata Memorial Center. And what we did was to conduct a series of meta-analyses that have been actually also been used by the Ayushman Bharat to approve or not approve certain packages in India. So some of you know that there is a class of drugs called PARP inhibitors, and even if you don't know, let me say that they are fancy targeted drugs that actually cause DNA damage and therefore are exceptionally effective in tumors that have genomic instability and where DNA repair mechanisms are already altered. So, but the problem is that they are also very expensive. So this is a trial of one of those drugs called olaparib, published in the New England Journal of Medicine a few years ago, and they showed that there is a marked benefit in patients who have a germline BRCA1 or BRCA2 mutation. There are several other trials, all of them published in the New England Journal of Medicine, with other drugs of this class, niraparib, veliparib, olaparib, and more recently rucaparib. And most of them variably showed that the benefit of these drugs in first-line treatment of ovarian cancer might be there, is there, but the question was which subgroups benefit and which don't. And by the way, the US FDA has approved these drugs for use all across in all kinds of ovarian cancer patients, regardless of their BRCA mutation or HRD status. So what we did was to conduct individual patient data and trial level meta-analysis. And what we did was we extracted individual patient times. So some of you know that when you conduct an individual patient data meta-analysis, I have to write to you to get your raw data. But there's a way to extract individual patient times from published survival curves using the software WebPlot Digitizer. We extracted this data from all these individual trials and then synthesized it using the stata command IPDFC. And on the left that you see is a survival table that is constructed entirely from data that is extracted from published survival curves. On the right is not the original survival curve, it is the reconstructed survival curve from that extracted data. And although this particular meta-analysis was published last year, we first pioneered this technique in 2020, and I will just show you that for breast cancer as well. So coming back to ovarian cancer, what we showed was that on the extreme left are women with BRCA1 or BRCA2 mutation. In the middle are women whose tumors have homologous recombination deficiency, and in both of them, the PARP inhibitors provide substantial, meaningful, and significant survival benefit. But on your right is patients whose tumors do not have homologous recombination deficiency, and in them there is no benefit. Now this is at odds with what is the approval for these drugs from the US FDA, and our results suggest that we must restrict these relatively expensive drugs only to particular subsets of patients, and that's how it is, at least in India. in passing, I might just share with you that we also conducted a study to look at the prevalence of BRCA1 and BRCA2 mutations among patients with ovarian cancer, and we found a substantially high percentage of these mutations at about 20%. And what was surprising was that these mutations also occur at a relatively high frequency in patients without any family history. So coming to the second meta-analysis, so in ovarian cancer, there is their natural history is comprised of repeated relapses, but the tumor continues to respond repeatedly until it runs out, until the drugs run out. And so the question is, on the first occasion, there is no doubt that one should perform surgery, but when the disease comes back, should one perform a second surgery or not? And we conducted again an individual patient data meta-analysis. And the reason why we did this is because there are discordant results from these three trials. On your left is the American trial that shows actually that performing a second surgery might be harmful, but in the middle is the European trial that shows that it benefits, and on the right is the South Korean trial that also shows that it benefits. And the reason why this is important is that when a patient comes to me in the clinic, in Tata Memorial or in any other hospital, do I perform the second surgery or do I not? And so this is the extracted individual patient data meta-analysis, and you can see that on your right, overall survival, that is the gold standard endpoint. The curves are right on top of each other and there is no benefit. And this is what we concluded from this meta-analysis, that you cannot split the surgery group into those that have been able to undergo complete surgery and incomplete surgery, and then compare only the complete surgery group with the no surgery group. That's not the way to analyze data. That's not the way to compare data. And we conclude that it is not beneficial, and this paper was published in the International Journal of Gynecological Cancer. This was a very impactful analysis, again an individual patient data meta-analysis of 11,000 patients in 6 randomized trials. So some of you know that there is another variety of breast cancer called the HER2 positive breast cancer, and here we have a slew of very effective drugs called HER2 targeted therapies. The prototype HER2 targeted therapy is called trastuzumab or Herceptin. And again, this has been a very expensive drug. The standard way of giving it is for 1 year to patients who have undergone surgery. But can you get away by giving them only 3 or 6 months of this treatment? And the way the original trials were designed by the pharmaceutical company, obviously they did not have a shorter duration arm, but then several academic trials were done that compared 3 months versus 1 year or 6 months versus 1 year, and individually none of those trials were able to prove non-inferiority. And what we did was to prove that when you compare shorter durations of 3 to 6 months versus 1 year of this expensive drug, the shorter duration is non-inferior for both disease-free and overall survival. And this was combined with a cost-effectiveness analysis that we did with Dr. Shankar Prinja from PGI Chandigarh, where we showed that 1 year of trastuzumab at current cost and at current GDP per capita of India is not cost effective, and therefore we must use only 9 weeks to 6 months of this drug. And this is how the approval for this drug is in the Ayushman Bharat scheme. Let me change tack to cervix cancer. So some of you know that cervix cancer continues to be a very important cancer, especially in rural India. Its incidence is declining. Breast cancer is becoming more incident, but nevertheless, there's a large case burden of cervix cancer. This was a study where we compared surgery with concurrent chemoradiation, which means radiotherapy given simultaneously with chemotherapy, and in the other arm was the experimental arm of neoadjuvant chemotherapy followed by surgery. And the reason was that for many, many years it was felt that radiotherapy resources are scarce. And so therefore, why not, instead of giving radiotherapy to these patients with locally advanced cervix cancer, why don't we just give them some chemotherapy and then operate on those tumors? And believe it or not, despite the reasonably good radiotherapy resources, doctors in several European countries, South American countries, as well as Asian countries, including India, continued to practice neoadjuvant chemotherapy followed by surgery and not concurrent chemoradiation. And of course, there was never a comparison between the two approaches. So we conducted this study, and I had the good fortune of presenting this at the plenary session of ESMO a few years ago, and then published it in the Journal of Clinical Oncology. And we showed unequivocally that radiotherapy was the better way to treat these patients. And after these results, these were the very first results on this question. After these results, the corresponding guidelines were changed throughout the world, and in all parts of the world, including Latin America, Europe, Asia, East Asia, etc., the practice of neoadjuvant followed by surgery stopped. More recently, we showed that giving radiotherapy with more finesse, with more focus, using a technique called intensity modulated radiotherapy actually reduces the side effects. Now again, this is an important question to answer. If you go to many therapeutic areas, they are technology intensive, they are resource intensive. In IMRT can only be given with fancy radiotherapy software and equipment, and it also takes more time to plan. So at the government level, at the resource level, whether one should treat using this fancy technique or whether one should treat with plain simple 3D CRT is an open question. And we showed again for the very first time that side effects on bladder as well as on the rectum are far lower when you use intensity modulated radiation, something that will make a difference to the lives of patients who survive their cervix cancer for many, many years to come. Let me come to the end. I used to be relatively good at mathematics, actually very good at mathematics, but I knew that I could never be a creative mathematician. But that fascination has nevertheless persisted. So let me talk a little bit in the end about mathematics, beauty, biology, and disease. Mathematics, it seems, is built into the fabric of nature. For example, there is this ratio. When you add up two numbers and take a ratio of the addition to the larger number, and when you take the ratio of the larger to the smaller number, and when both of them are equal, the ratio comes to about 1.62. And this is called the golden ratio. And let me give you an example. So on the right hand side, you see it is 61.8 and 38.2, and they add up to 100. And 100 divided by 61.8 is 1.62, and 61.8 divided by 38.2 is also 1.62. Now you might ask me, what does this have to do with either biology or humans or human organs or cancer or whatever, and I will come to that in a minute. There's another sequence that some of you might know, especially those of you who conduct phase 1 clinical trials. It is called the Fibonacci sequence. When you start with 0 and 1, and when the next number is the addition of the immediately preceding two numbers, you get what is called the Fibonacci sequence. So you will have 0, 1, 1, 2, 3, 5, 8, 13, 21, 34, 55, 89, and so on. And of course, it's an infinite series. Now, the interesting part of this Fibonacci sequence also is that beyond the first few numbers, the ratio of the next number in the Fibonacci sequence to the previous number is also the golden ratio, 1.62. It turns out that both the Fibonacci sequence and the golden ratio are deeply embedded in nature. So the spirals of stems where they sprout leaves, the number of petals in a flower, and many other examples, all of them follow the golden ratio and the Fibonacci sequence. So that brings me to this wonderful editorial or a perspective in the New England Journal of Medicine by Mike Baum a few years ago. So on your right is the English weeping willow tree, and let me describe in the words of Mike Baum, the ratio between the lengths of the proximal and distal branches at each bifurcation is the same as that of the length of the trunk to the length of the first branches, approximately 1.62. And that ratio also holds for second, third, and fourth order branches. Exactly as I explained to you in the first slide about what is the ratio of the larger to the smaller numbers to their addition is what is the golden ratio. So the repetitive golden ratio at ever smaller scales, as you see in the English weeping willow tree, is an example of what is called fractal geometry. So fractal is a complex geometric pattern that repeats itself at infinitely smaller scales. So which, in other words, it exhibits self-similarity, meaning that if you take the fourth order snapshot of the English weeping willow tree, and if you look at the first order snapshot of the English weeping willow tree, they are similar except for size. This property makes fractals visually captivating and mathematically intriguing. This is the whole slide mount of the breast of a 15-year-old girl, and you might have guessed this shows the lobular architecture in that breast, and actually the lobules follow the golden ratio and fractal geometry. This is a 3D rendering, or rather a 2D rendering of a 3D image of the pulmonary vasculature of a human being. This is a real picture. And again, the pulmonary vessels, the pulmonary vasculature also follows the fractal geometry and the golden ratio. It seems that nature has rendered its beings in the image of mathematics and beauty. And breakdown of fractal geometry and organizational beauty of the tissue is an early event in cancer. The more distorted and ugly looking the breast tumor, the worse the prognosis. And pathologists, of course, have recognized this for a long time. So the question is, and maybe some of the bright young researchers who may be mathematically inclined, or maybe you can collaborate with one of the institutes of technology, can we mathematically model the breakdown of symmetry and fractal organization to peep into the origins, prognosis, and patterns of recurrence in cancer? Let me end by telling you a story. This is the story of Stephen Jay Gould. He was an evolutionary biologist, philosopher, and paleontologist. He worked at Harvard, and he was diagnosed to have peritoneal mesothelioma in 1982. His doctors told him that the average survival of peritoneal mesothelioma, a devastating disease, is only about 8 months. And then but he was not an ordinary patient. He was a mathematician, philosopher. He worked at Harvard. So he decided to delve deep into his own disease. And let me describe in his own words, because I cannot do it better. He wrote a piece called "The Median Isn't the Message," and that's a very famous piece. I recommend that all of you read it. I immediately recognized that the distribution of variation about the 8-month median would almost surely be what statisticians call right-skewed. After all, the left of the distribution contains an irrevocable lower boundary of 0, but the upper or right half can extend out for years and years. From his reading of the literature, the distribution was indeed strongly right-skewed, with a long tail that extended for several years above the 8-month median. I saw no reason why I shouldn't be in that small tail. And ladies and gentlemen, Stephen Jay Gould actually died in 2002, 20 years after the diagnosis of peritoneal mesothelioma. And he did not die of mesothelioma, he died of lung cancer. So this is my very last slide, and I will just leave you with this, because all of us get very fascinated with p-values and with individual numbers. Statistical averages are useful abstractions, and by themselves do not encompass our actual world of variation, shadings, and continua. I have had the good fortune of having numerous collaborators, students, teachers who have been very kind to me, and I cannot individually acknowledge them, but they have been invaluable in my journey, and they have walked the walk. These are 2 exquisite pieces in the Metropolitan Museum of Art in New York, and I strongly recommend that you see them when you are next in that city. Thank you very much for your attention.
Wow, very interesting work on breast and ovarian cancers. I think smart ways of hitting cancer cells so that they do not escape. And the time is not far that we win over all types of cancer with Sir's groundbreaking research. Sir, your presentation was not only informative, but was very inspiring, and it truly reflects the dedication and passion you bring to this field. In recognition of the remarkable contributions and to express our gratitude, I would now like to request the Vice Chancellor, Sonia Nityanand Ma'am, to kindly felicitate Professor Sudeep Gupta Sir with a memento and shawl. This gesture is a token of our appreciation for the invaluable presence and the knowledge he has shared with us. Thank you, sir. Thank you once again. And at this moment, it gives me great pleasure to request Hardeep Singh Mehrotra, sir, to kindly step forward and felicitate our esteemed Vice Chancellor, ma'am, with a shawl. This gesture is a symbol of warmth and respect we hold for her, as well as a heartfelt gratitude. Thank you, dignitaries. Please take your seats. As we draw towards the conclusion of this landmark event, I invite Dr. Sujit Kumar Kar, Vice Dean Ethics of the Research Cell, to deliver the vote of thanks.
Thank you so much, ma'am. We are all at the end of this program. I got the opportunity to convey the vote of thanks. My sincere regard to Honorable Vice Chancellor, ma'am, our Chief Guest, Dr. Sudeep Gupta, Pro Vice Chancellor, ma'am, Dean Academics, Professor Amita Jain, ma'am, and Dean Dental, Professor Ranjit Patel, sir, respected dignitaries, faculty members of the university, invited guests from different parts of the city, students, respected IEC Institutional Ethics Committee members. I convey my sincere gratitude and thanks to all of you for joining this program, for your kind supports, for your active students, for your active participation in this program. I want to convey the team of our research cell, every member, starting from the clerical staff to the accountant to the sweeper level, all the members, they contributed significantly for the success of this program. Dr. Pragya Pandey, thank you so much for coordinating this program very well. And residents, Dr. Sneh, Dr. Arjun, Dr. Saurav, they are residents from Department of Neurology who coordinated this program very well. Thank you so much, Kanchanji and Nisaji, for helping in the program. Our sincere thanks to media for covering this program and showcasing the research showcase of this institute and facilitating the key information to the society. Thanks to all participants, and if I unintentionally missed any of the names, I am extremely sorry for that, but we heartily acknowledge your contribution to the success of this research showcase. Thank you so much.
Thank you, Dr. Sujit. Thank you all for making the Research Showcase 2024 an extraordinary celebration. And together, let us continue to advance the frontiers of science. So as we conclude, I kindly request everyone to rise for the national anthem, a tribute to our nation.
गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you. May I request the dignitaries to please stay because the organizing team wants to click with you. Requesting the organizing team to please come for a group photograph, and after that we will have a group photograph with the awardees also.